My name is Randy Lober. I'm Learning and Development Specialist here at Action Benefits, and pleased to welcome you to this morning session, CMS Medicare Marketing Changes for 2024. I am our Learning and Development Specialist here at Action Benefits, or one of our Learning and Development Specialists, and that means my job is to help agents like you think together, be compliant as you continue to grow your business, and provide a lot of that thinking and strategy alongside with you. Joining me here today is Debbie Brown, one of our account coordinators from our individual team. Debbie, want to give you a chance to say hi before we get started.
There we go.
There we go.
Good morning, everybody. I'm, as Randy said, Debbie Brown. And if you need anything, just contact the individual team. We're here to help you and help you with all this CMS and compliance information. So take it away, Randy.
Thank you for joining us here, Debbie. You've got a wealth of knowledge and expertise to share with us here today, and I'm sure that'll come out as you chime in and certainly help to answer some of our partners' questions here today. As advertised here on that slide, right, and in the description for this event, there's no less than 19 marketing changes you have to be aware of here for 2024. We're going to try and tackle those in 4 discrete bite-sized chunks. So as not to overwhelm you before you leave here today. So these are the 4 kind of big areas we're going to go over with you here this morning. First, we're going to take a look at what changed around marketing materials and make sure what you're using is compliant with those new and existing rules. Next, we'll dive into events. What's changed around those? What can you do and what can you not do now under the new rules? We'll take a look at what your behavior before an appointment. So what has changed around scopes of appointment and other things here as AEP is around the corner. And lastly, we'll spend some time with what you do during an appointment, making sure the call recording and disclaimer and everything else is as it should be ahead of this busy time of year. Before you get started, I want to give you a little background information, if you will, about where all these rules and regulations come from. So you know it's not just Debbie and I making this stuff up off the top of our heads. Because spoiler, we wouldn't make this up off the top of our heads. Some of these rules make it a little bit tougher for independent brokers like yourselves to do business. But we want to make sure that you're aware of them going forward. So we should know that the backbone of the guidance we'll talk about here today comes from the Medicare Communication and Marketing Guidelines, and that is updated fairly regularly by CMS. The latest version of those was released on February 9, 2022. But that version is not what really spurred a lot of the changes we'll talk about here today. Each year, the Center for Medicare and Medicaid Services also does some rulemaking to govern how carriers and how brokers and agents act in the Medicare market here as well. So the final rule for this year was released on April 5th, 2023. And there's been some additional guidance that's come out in memos since then, which we'll highlight a little bit later on. So you might be looking at the Federal Register for maybe the Medicare Communication Marketing Guidelines. And there's this other several layers of regulation on top of that. Both documents have guidelines for carrier behavior, and both documents, so that is the communication guidelines and the final rule, which we'll just talk about a bit more in detail today, have a lot to say about how we as agents and what CMS is calling third-party marketing organizations, how they behave and how they act within the market. So that's kind of where the background is here today. That's the foundation of all this knowledge that we're about to drop on you. Let's go ahead and get into those changes that you'll need to be aware of here for plan year 2024. We're going to start first with some changes that have happened here on the periphery. So things that might not directly impact your day-to-day business, but they're going to impact things that you're seeing going on around you. They might impact the behavior of some of your carrier partners or some competitors. So we want to make sure you're aware of those. First things first, number 19 is that plans must have a committee to ensure agents and brokers stay compliant. And many of you might look at this and go, well, yeah, aren't they already doing that? And the answer is probably most, yes of them are, but now CMS has put it in black and white that the carriers are responsible for having this committee to make sure everything we do as a carrier's downline and everything you do as independent agent or brokers stay compliant with all these rules. That's kind of a no-brainer, but what CMS is really getting at here, or one way to interpret this guidance, is that for all of those odd actors out there in the market, right? Those firms, those call centers that give you your ads with your Joe Namath and Jimmy Walkers that have been kind of skirting the bounds of compliance, they all got appointed somewhere, right? They all got appointed by carriers. We see this as CMS kind of firing a warning shot across the bow of those carriers saying, hey, if you are letting these people be appointed with your to sell your products, we're going to ask you to help enforce some of these guidelines as well. So interesting action on the outskirts of your day-to-day lives here. Another new change to be aware of is that plans must provide annual written notice that beneficiaries can opt out of phone calls regarding Medicare Advantage and Part D business. So again, the carrier's obligation is to do so. And beneficiaries, again, have the option to either remain in contact or to leave contact at any time they so choose. Another organization, or another rule rather, specifically targeting your Jimmy Walkers and your Joe Namaths is this one. Organizations may not market benefits where they're not available. And where this likely stems from is the big nationwide commercials, right? That promise over-the-counter cards, that promise dental, vision, hearing benefits, and transportation, and so on and so forth. Lots of big promises that are going to get a senior to pick up the phone and say, Joe Namath, tell me what you're talking about. I want to hear more about it. Only for that senior to later find out that that benefit isn't available where they live. Because as we all know, plans have varying service areas. And even though the plan might have a different service area, not all the benefits that the plan offers is available in a particular area as well. So again, a crackdown on that. And that might talk to you if you market in a statewide or regional sense as well. You want to be careful about what benefits you're talking about there. But really, again, aimed at reining in some of those larger national marketing organizations. Another change on the periphery is, and again, you're targeting the same national actors here, is we cannot market available savings based on comparison to what they would save if they were uninsured, unpaid costs of dual eligible enrollment, or other unrealized costs. Long and short, they can't say that Medicare Advantage saves you money. They can't say that PDPs save you money in comparison to any of those three things. So again, CMS is really making an effort to make all that national advertising a bit more honest. And we you as independent agents and brokers have to play by the same set of rules here. And the other one that's really interesting, we put this on the periphery because it's not a final rule yet, but CMS does reserve the right to ban the sharing of beneficiary contact information. In plain language, that means for all those lead gen organizations out there, maybe you're buying marketing lists or buying Turn 65 lists. CMS does reserve the right to require those organizations to obtain the beneficiary's consent to share their information with you. And I don't know about you, but most people I know don't love their information being shared, right? So it's unlikely that you're going to get that opt-in, or that those lead gen organizations will get that opt-in from consumers to share that beneficiary, to share their information, should this regulation ever go into effect. But because CMS felt strongly enough to comment on this in the final rule, it's safe to expect that some changes around lead gen or lead sharing organizations might be on the horizon, if not here in plan year 2024, coming up mid-year, maybe in 25 or 26. So if I say that all that to say that if buying leads is currently something you're in the habit in, you may want to look at diversifying some of your marketing efforts so you don't get left out in the cold should what's acceptable around that change. Debbie, I want to check in with you real quick before we check in with our audience. Which of these seems most impactful, or what else should we notice about these changes here?
I mean, the bottom line is just be careful of what you're saying and doing to make sure you're staying within those guidelines. If you have any questions or concerns, just call our department and we can definitely help you get through these, and just be smart. not share anything that you're not supposed to, or just make sure you're letting them know what you're doing. Be, transparent.
Yeah, absolutely. And transparent and truthfulness is really the heart of these changes here. Want to hear from the audience as well. Go ahead and type a word or two in the chat. Which of these seems most impactful, or are they not, or they just seem quite on the boundary yet? Go ahead and write a few words in the chat for us. Want to see what's on your minds here. Yeah, so seeing some sighs of relief come in the chat, actually. Some thank you for regulating Joe Namath, Jimmy Walker, and all those organizations. Some of us, of course, Robert says publicly here, don't deceive, right? Don't go in there with the intention to deceive. That's a line from Hotel California, if memory serves. But yeah, that's absolutely true there as well. We want to make sure we are being straightforward with our beneficiaries as we work to support them. Speaking of being straightforward and being honest, let's talk a bit about sales materials and what's changed for you there. First thing is that all sales and marketing materials must be first approved by the carrier or carriers and then CMS. So if you have anything, that's homebrew, right, that you're making in your agency, and you're talking about Medicare in those materials, that's likely going to have to go through carrier approval process and then up to CMS for approval. All told, that timeline is somewhere between 45 days and 7 weeks, depending on which source you look at. So between 45 and 49 days. So the likelihood you'll get something new approved before AEP is over is slim to none. So always a good bet to, especially now at this time of year, rely on what your carrier partners have produced, because those already have CMS approval and, of course, the carrier's approval. You'll also note that carriers, just as you are obligated to change some of your language, carriers are obligated to change some of their language here as well. So superlatives, things like best and most, you'll no longer see those in your carrier marketing materials unless they have current year materials available to support that statement. So you can't say we offer the best Medicare Advantage plans in Michigan unless you've got some darn good factual information to back that up. Just as you in your marketing and sales appointments have to avoid words like best and most, that prohibition has been extended to carriers here as well. The other biggie that comes out of this section is the tighter regulation of the use of the Medicare name, logo, and card. We've been in contact with a few of our agent partners who have the word Medicare that have appeared in their agency name or in their email address or in their URL, right, their website address. And this particular section of rulemaking specifically outlaws that practice. So you may need to consider adopting a DBA or working to file a DBA to change your name and work on some of your rebranding efforts. Our op team is happy to help you work with that as you go forward there. There's also tighter restrictions on the use of the Medicare logo and card. So when we're talking about the logo, there's been, and again, I haven't seen from our partners, but CMS says they're seeing a proliferation of people using things that look a lot like a Medicare logo or that look a lot like the Health and Human Services logo in an effort to try and make themselves look more official, make them look like Medicare, or make that agency look more like the government. CMS says that's misleading and that's not okay either. And there's also cases where, and we have seen this in many places around the state, even Ohio and other places where we're working here as well, where some of us use images or approximations of that Medicare card, that red, white, and blue Medicare card in your marketing. Again, the CMS now outlaws that, saying that that could be misleading for consumers, right? It makes you look too much like you're from the government or from CMS or from Medicare, and that could sway an unknowing consumer into working with you. So in order to level the playing field, CMS is outlawing that as well. You'll also notice that medical benefits are going to now be codified and listed in a specific order in a plan summary of benefits. So just like in the under 65 market where you have summaries of benefits and coverage, And those have been kind of standardized, what that looks like. The format for your summaries of benefits is going to be standardized here as well. So as you are digging into your carrier portals and looking at 2024 information, you're going to notice that MOOPs are in the same place at every single summary of benefits. You're going to see inpatient, outpatient, all those services in the same order on the summary of benefits. I love that change. Makes it a bit easier for you to read the plan documentation. Also makes it a bit easier for your clients, your beneficiaries and prospects to read that plan documentation as well. Beverly, see your question. I'm going to give you one more tidbit of information before we pause here to answer that. And there's one more thing here to be aware of. This is a bonus. We didn't include it in our list of 19 things because this came as a bonus from a memo here. And the definition of marketing materials has changed. I'm going to read you the legalese here, and I don't make a habit out of doing this, but I think this is a really powerful excerpt from the recent memo that came out in late May. So it says here, as stated above, marketing requires both intent and content. Content that beneficiaries can receive benefits such as dental, vision, cost savings, or hearing services is sufficient information about plan benefits, benefit structure, or cost sharing to meet the content standard in the definition of marketing in those sections. Further, the use of these statements in advertisements and activities directed to Medicare beneficiaries clearly meets the intent standard. Therefore, beginning July 10th of this year, any material or activity that's distributed via any means, including mailing, television, social media, so on and so forth, that mentions any benefit is considered marketing and must be submitted into the approval system, meaning that carriers and CMS must approve that. So practically, what does this mean for you as agents? It means if you have any home brewed or home created or agency created materials that even if you're putting original Medicare and Medicare Advantage side by side, when you're talking about Medicare Advantage, you say it includes dental, vision, or hearing. As soon as you've included words like dental, vision, hearing, and those specific benefits, you've now crossed into marketing territory under this new guidance, and that's going to trigger the requirement that your carriers approve it, and it's going to trigger the requirement that CMS approves it. So want to be careful of that, especially if you've created any materials that could have been educational in the past. You'll want to take another look at those and see if you call out any specific benefits like especially dental, vision, and hearing, because those now fall into that marketing category, and you want to make sure you limit your exposure there for any running afoul of the regulations. So I want to check in with the audience here, give you a chance to respond to this, then we'll dive into some of the questions that have come in here so far. How does what we've talked about here change your use of marketing materials going forward? And then we'll go ahead and Debbie, do you have anything to add on Beverly's question or anything to add here in general?
Well, the only thing with Beverly's question, you just got to make sure that you got to take Medicare out of, if you've got best Medicare plans at AOL.com, that's got to go. You got to change that. If your name has got Medicare, anything that's got Medicare in it, you've got to take it out. It's got to be removed. That's the only thing we can tell you right now is that name's got to be removed, and unfortunately, you're going to have to change everything.
The other thing to be aware of here is if you want you to take a look at your business cards, right? If your business card says anything like trusted Medicare expert or trusted Medicare advisor, that's also a no-go under these new rules, because again, that in CMS's eyes, that could make it look like you're affiliated with the government. So take a look at any taglines or any slogans or any logos you have where you use that Medicare word. And if the chances are that a consumer could construe that to believe that you're somehow connected to the government, it's probably got to go. But you could reframe that, right? You could be a trusted benefits advisor or a trusted senior advisor if you wanted to make a simple one-for-one swap there and not change your words to change your wording or change the whole layout of your business card. So be really careful with that as well. Find other ways to present your trust and your credibility in the community without using the word Medicare. And I do love that the thought you added there, Beverly, about always using carrier-approved material, not self-generated. that is going to be the best way to stay compliant here going forward, because you know that stuff's already been approved. Also see again,
Also, Randy, also I want to add to Beverly's as well. That was great. That's great advice. Also, make sure you don't try to recreate the kits. You want to like, oh, take this out or that out. Please do not touch any of the kits. You shouldn't be altering anything. Those are all CMS approved, and you need to keep everything intact. I know it looks like a piece of paper that shouldn't be in there, but you've got to have it in there. It's a 5-star rating, got to have it in there. I think there's a language page, keep it in there. I know that's just what you got to do. So.
Yep. If it ain't broke, don't fix it, right? And as far as the CMS is concerned, all those documents ain't broke. So you make sure they're getting in front of your clients as you're working with it. Martez, you're absolutely correct. Medicare specialist is a no-go too. So again, because in CMS's eyes, that could make you look like you're from the government or look like you're associated with it too closely with the Medicare program. If you need more help, right, brainstorming around that, I do invite you to contact your account manager, or I'm happy to set up some time with you here as well. You're exactly right, Pamela. You can't use Medicare specialist on your business card. Anything that makes it look like you could be affiliated with Medicare and CMS's eyes is a no-go here. But again, got some other changes to attend to here as well. If you'd like to talk about this more, please reach out to our individual team, or again, get in touch with me. I'll give you my contact information at the end of the session here, so we can go ahead and find some alternate solutions. And we also know that, especially for agents that work with us, rebranding, printing all those stuff can be an expense you might have trouble with this kind of year, because the next 3 months are where you're making the most of your money. We might be able to help you out with some of those expenses here as well. Let's talk about events and what's changed for you there. First thing we should notice is that educational and marketing events cannot be scheduled within 12 hours of one another at the same location. So if you, in the past, right, or even as recently as last year, you could have educational and marketing events back to back. You could have at 11 o'clock in your library, say, I want to tell you about parts A, B, C, and D. And at 1 o'clock, come back and say, all right, let's show you the value of Blue Cross or Priority Health and start enrollments and so on and so forth there. No longer possible. Got to be a 12-hour gap between those. So if you want to get your prospects and clients out of bed at 7 o'clock in the morning, bring them to your local library and say, hey, let me tell you about A, B, C, and D, and then bring them back at 7 o'clock that evening, 12 hours later, and then have a marketing session, that's okay, but I don't know how much traction you'll get at either of those. So you're practically speaking, you're going to have a 24-hour gap or so between these two events. Did have a question in a previous version of this is, what if another agent schedules an event at the same place at the same time, right? Maybe you're looking at senior centers or at the same place at a different time, because at the same time is not too likely. But maybe another agent that you are unaware of scheduled an event at the senior center. Maybe theirs was educational and yours is marketing, or vice versa. As long as there's no evidence that you two coordinated for that to happen, so you're not part of the same agency or anything like that, that's okay. So accidental scheduling of those two events in the same venue within 12 hours, that's not going to run afoul of the letter of the law here. But purposeful skirting of that regulation could get you in trouble there. The other thing that's new this year is you cannot collect scopes of appointment at educational events. So you cannot set up that appointment. You cannot figure out what they want to talk about with you there at the educational event. That is reserved for marketing events only. But here's what you can do at educational events. If I use those business reply cards, right? Yes, I'd like a licensed health insurance agent to contact me, and here's my contact information. That's as good as consent to contact, and that gives you permission to go ahead and call out to that person and set up an appointment with them. So a minor change to maybe your workflow there, but still one to be aware of. No SOAs at educational events. Instead, business supply cards are going to be your way to go. So I want to ask you this question here while I check in with the chat. In what ways does that read that rule, prohibited collection of SOAs at your educational events, does that impact, does that change the value of those events? Does that change how much or how frequently you want to do those events? Love to hear what you're thinking about that in the chat. Debbie, want to hear anything else you might have to add too while our audience is thinking about that?
You got everything covered there, Randy. Everything looks good, unless anybody's got any questions.
I see a question from Anthony. I'm taking a moment to read it, but would love you to look on that as well. Yeah, Anthony. So as I read it, and based on what you've worded here, so for everyone, because you can't see what Anthony's put in, he says if you run a radio ad and it's generic, just saying open enrollment states for Medicare Advantage and MedSup, no rates or carriers, and how to contact the agency. Do we need to say limited plan disclosures on the ad so that the disclaimer we'll talk about here in a moment? Yes. The reason is because you're likely slipping into some marketing language, right? You're asking the consumer to contact you, right, as your Medicare, as that Medicare professional or as that insurance professional in that ad. Would err on the side of caution there and include the Medicare disclaimer. Did see something come in to the question I posed here. As some of you are saying, well, maybe it doesn't change the value. Some of you are saying, well, maybe I'm less likely to do an educational event. For our money, those educational events still have a lot of value. And the reason why is because it gets you out there in the community, helps to build your know, like, and trust value in the community. When you're out there as an expert, you can't, you're not selling anything, right? You don't have permission to sell there. You're just to prevent just the facts, man. And that can, again, be a comforting boost to agencies or to members of your community. So not a bad idea to keep going with those events, especially here as AEP keeps rolling on. And you're welcome, Anthony, for answering that. Let's talk a bit about what happens before deployment. So in this next little segment here, we're talking about what changes around the scope of appointment rule and what changes around the rules for contacting your beneficiaries here. First things first is the 48-hour rule is back. For those of you who maybe are newer to the rule, that 48-hour rule says there's got to be a 48-hour cooldown between the time you take the appointment and when the marketing or sales appointment or the enrollment appointment takes place. 48-hour rule applies to the products you see here on the screen. So your Medicare Advantage, your MAPDs, your PDPs, dental vision hearing buy-ups, ancillary products, and well, not explicitly to Medicare supplement products, but there's a reason I included here. It is very unlikely that you are going to have an appointment that only talks about Medicare supplement. Because you're probably going to be asking that person about prescription coverage, whether they need it, what drugs they're on, so on and so forth. And when you bring up that PDP, or when you'd like to bring up that PDP and talk about drug coverage, you're going to trigger this scope of appointment requirement for that. So the best practice here to keep everything simple going into AEP here is to get an SOA for everything. Even if you think it's only go to MedSup, again, the chances are high you're going to bring up those PDP plans. The consumer is going to want to talk about drug coverage. For our money, it's a best practice to get an SOA that has everything, and to the extent possible, check everything on that. Gives you lots of leeway in the products you discuss within that sales or marketing appointment. There are some exceptions to the 48-hour rule, and those go as follows. First is within the last 4 days of a valid enrollment period. So in the last 4 days of AEP, if someone comes up to you and says, hey, I need a Medicare plan, you don't have to make them wait 48 hours before that appointment. You can still have to take that scope of appointment, but you can work with them as a walk-in basis there. The other exception to the rule is for unprompted walk-ins or inbound calls. So if Joe Schmo walks into your brick and mortar office and says, hey, sell me a Medicare plan, you take that scope, you can go right into the appointment right there. Or if you have an inbound call, maybe from a referral, right? Someone calls into you and says, hey, I think Nancy said you did a really great job with her benefits. I want to hear more about what I can do. You have to complete that scope there, right? But you don't have that 48-hour cooldown because the beneficiaries made that intent to work with you there as well. Debbie, anything to add about the 48-hour rule while we check in on Emily's question here?
No, just make sure you're always taking a SOA form. Whether, like he said, a walk-in, just write walk-in. If it's a phone call, put on telephonic. Basically, if your client calls you, they said, hey, I want you to come to my home for an appointment, and that's pretty much when you're going to have to get that 48-hour rule or 48-hour SOA. Also, if you send us an application to our office to submit the enrollment for you on your behalf, which we are more than happy to do, we're always going to ask for that SOA form. If it's, hey, didn't meet the client because it was a husband and wife and you met the husband but not the wife, just put that in your email. No SOA form due to no contact with member. And going back to what Randy said, yeah, they have all those plans out there. No, you don't need it for the Medicare supplement plan, but there's more than likely you're going to be talking about the PDP. We don't need it for the dental vision hearing products, but you are going to be talking about the plans that have the dental vision hearing. So you're just protecting yourself. So just be prepared. It's just a checkbox, and now you're covered all the way.
Thank you, Debbie. Good insight to have, especially is what our team will ask of you if you choose to use us to submit your apps. Emily, I see your question. I'm going to answer a bit of it right now, and let me know what this does or doesn't do for you here. So Emily's question for those of you in the chat says, do we need a new SOA every year? And how do I start gathering those? What the new rules do clarify is your consent to contact, whether you gather via scope of appointment or a business reply card, is only valid for 12 months or until you use that. So if, for example, you have an SOA that gets filled out or got filled out yesterday, right? You're going to go meet that client 40 hours from yesterday, which is tomorrow, depending on how the math works out. You meet with that client, and maybe that appointment doesn't result in an enrollment or a sale. You've used that SOA. So if you're going to go back to them, you're going to need to grab another SOA if they are hemming and hawing on their options, and so on and so forth. So how do you obtain SOAs ahead of time? Could be a good a mass mailing, as you said, to your current clients, Emily, could be a great way to do that. Because they are current clients of yours, you do have the option of giving them a phone call here as well and talking with them about whether they'd like to make any changes and collecting the SOA that way as well. But because that's a call, they're going to need that 48-hour cooldown period. So mass mailer, maybe one of the safer bets and less cumbersome bets. Or maybe an email campaign that invites them to call into you, your current clients to call into you to set up the appointments. Any of those could work. Debbie, anything else to add about that one?
Sorry, trying to keep finding my mute button there. No, yeah, I mean, what he said, the SOAs are good for 12 months. Another way that if you're having a hard time, maybe the member doesn't have a way to come in and sign one, or you can't send one out soon enough. Also, don't forget, we have DocuSign available to you, and all the SOAs are in DocuSign, so you can always send it to an email. Our seniors are more sophisticated now, so they have access to emails and would rather do everything online. So you have that availability as well.
And for that matter, Sunfire is available to you as well, which allows you that end-to-end kind of SOA quoting enrollment experience all in one place. So if you don't want to chase documents around the front through a few different platforms, Sunfire does a pretty good job of doing that. And we'll show you that portion of coverage for one a little bit later on this month. So lots of different ways to get it done, Emily. Just a matter of what best fits your business practices. Let's also talk a bit about this one. It's not a practice we've run into much, but CMS has apparently found it occurring often enough to make a rule against it. So maybe you have a whole apartment building or a whole condo complex that you're working with, and you have scopes of appointment that don't necessarily have a specific appointment time attached to them. You just say, I'm going to see you all on the 17th or on the 18th or whatever the case might be. You cannot go door to door without a set time, even with scopes appointment secured. So what you could do is say, I'm visiting this condo complex. Miss Smith, I have an appointment with you at 12. I have an appointment with Miss Jones at 1 o'clock. I have an appointment with Mr. So-and-so at 2 o'clock, so on and so forth with those set appointments. But you can't just collect a stack of SOAs and assume that gives you permission to go door to door within that apartment complex, or that city block, or whatever the case might be. Want to hear what you guys are thinking about the 48-hour rule. How do your practices change with the return of the 48-hour rule, while we attend to some other questions that have come in here? Good question from Martez coming in. So if you have a current client who wants to switch a company, and even if they don't make that switch, because you're still talking about benefits, it's going to require an SOA, right? Anytime you're talking to them about a product, it requires an SOA. So even if no sale results, right? Maybe they decide they're happy with their current plan. And for the question that's here on your screen, some of you are coming in saying, well, I have to comply with that 48-hour rule now, right? So maybe it does change your early AEP communications a little bit. Maybe you do mail some of your current clients or reach out to them there. But one thing to be aware of going forward, that the 48-hour rule is, in fact, back in action. So let's talk also about what happens during a call or appointment. So our last 5 changes we need to talk about here today. And first thing is which is hopefully leads many to breathing a sigh of relief. The call recording requirement has been narrowed. So it's narrowed to include your marketing, including retention calls. So calls you have to existing customers about products. It also includes sales calls. It includes your enrollment calls for MAPDs, MAs, and PDPs. But you no longer have to record service-oriented calls, such as when's my effective date, or I didn't get my ID card yet, or anything else that falls into that branch. But when you're engaged in marketing, so anytime you're talking product to a existing client or a prospect, or you're actually conducting that enrollment, those are the calls that'll need to be recorded. And by the way, if you have not taken advantage of Action Benefits Call Recording Solution, highly encourage you to do so. Available to you at no cost, and available from any touch tone phone you use. So you don't have to be tied to a computer to do it. For more information, again, happy to tell you more about that, or reach out to your account managers. The other thing that comes out of the guidelines is the CMS has clarified that Zoom calls, any video call, does count as a call that must be recorded. You do only have to record the audio portion of those. But chances are, if you're having a video call, it's easier to record the whole darn thing than it is just to record the audio. Those recordings, just like your phone call recordings, do have to be recorded and stored for 10 years. So want to make sure you're aware with that if that's a way you choose to do business. Let's talk about the big, hairy, confusing stuff, as if the other stuff wasn't confusing enough already. There's been some changes that CMS has made, what they call the TPMO disclaimer, and that's the language that you're meant to read in the first minute of every sales appointment. That's meant to appear in your email address, or in your emails, that's meant to appear on your website. If you do happen to offer every plan in your beneficiary service area, and remember, what dictates which disclaimer you use and the numbers you use in the disclaimer here is the beneficiary service area, or so where they live, not where you work. If you do offer all plans in an area, your disclaimer now sounds like this. Currently, we represent insert number of organizations. That's the number of carriers you have, which offer insert number of plans, which is the number of Medicare Advantage, MAPD, DSNPs, and Part D products that those carriers offer in your area. You can always contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance assistance program, SHIP, for help with plan choices. But again, you're only using this version if you do offer every plan in a particular service area. More likely, though, The chances are you do not offer all plans in an area. So this is what your disclaimer now sounds like. We do not offer every plan available in your area. Currently, we represent blank number of organizations which offer blank number of products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance assistance program to get information on all your options. So practically what this means is maybe you work in Oakland County and maybe you also have clients in Livingston and Washtenaw. Even just looking at the plans that Blue Cross or Priority Health or United Healthcare or McLaren offer, they offer different numbers of plans in each of those counties, meaning you're going to have different disclaimers for each of those counties that you're reading to beneficiaries that live in each of those areas. And yeah, that gets a bit confusing, but I have more good news for you there. If you currently do partner with Action Benefits for any of your Medicare business, I want you to check your actual physical mailbox at the end of this week or maybe early in the next. We've got a little gift for you that's going to give you a list of all of the 83 Michigan counties and all of the number of plans that our carriers offer in those counties. Hopefully makes it a bit easier for you to comply with that disclaimer. If you don't yet partner with Action Benefits, you still have the opportunity to move your Blue Cross business with us at any time. And again, we're happy to provide you with that access to that tool if and when you do make that choice. Debbie, anything to add about the disclaimer before we hit our number one change here?
Nope, you got everything covered. If you guys have any questions, contact anybody in the individual team. Will help you with that.
All right, thank you. The other thing that is new is a change in the pre-enrollment checklist. So currently you have that pre-enrollment checklist you read at the end of every appointment. There's one more thing that's been added to that list, and that is that you must explain the effects of a current enrollment choice on current coverage. So say your client chooses to go from a Medicare supplement plan over to a Medicare Advantage plan. It's now incumbent on you to tell the client that that Med Sup doesn't terminate automatically. So you've got to tell them what steps they've got to take to terminate that Med Sup. If they are changing Medicare Advantage plans, you've got to tell them that the previous enrollment will terminate automatically on the plan's effective date, so on and so forth. Or if they're changing their PDP, again, because that previous enrollment will terminate automatically. So it's up to you to know how those coverage options work and explain them to consumers as part of that checklist there. So one more question for you here before we wrap up today. How does that set of changes impact your appointment flow? We'd love to hear what's on your minds or hear anything else that as Debbie is thinking about here. Anthony, you've asked the million-dollar question to which CMS does not have a good answer yet. And for the benefit of the entire audience, on a website, what number do you list on the disclaimer? Since you don't know who is looking at the website from where, or for a radio spot or an ad running in multiple areas. For the radio spot or the multiple areas, that can be a little bit easier to answer because likely when you are running the ad, you're doing some geo-targeting. So maybe you're running the ad in Macomb, Oakland, and Wayne counties, or you're in Washtenaw, or you're in Livingston. You got a good handle and can reasonably expect it to comply with that and run a version of that ad that says what you support and what you offer in those counties. The website, CMS doesn't have a great answer for yet. We've seen a few different pieces, from other industry experts, but no real solid answer on that from CMS. So because there's no solid answer from CMS, I'm hesitant to go on tape here and say here's the one way you should do it. But I can give you a few examples of what we've seen out in the field. Some people are saying that they look at the highest number of plans they offer in that area. So maybe if you have a radio ad or your website, if you're running an ad that drives people to your website on the west side of the state, or you're looking at statewide, maybe the number in your disclaimer reflects what you do offer statewide. And you're exactly right here, Anthony. When you're looking at a national provider, one said they offer 1,495 plans. And that's where this gets really tough and kind of difficult because that is their best effort, right? So they're showing you what they offer over the entire country. Is that information really helpful to the consumer? Does the consumer really know how many Medicare Advantage plans are out there? Do they know what percentage 1495 is? I don't know. But that's one way to do it, is to roll with the highest number of plans you represent across all your service areas. Another way you could roll with it is go with a range. I represent 0 to 3 carriers that offer 0 to 36 plans in your area. CMS, again, hasn't come out with real clear guidance on this. And as soon as we hear anything, we're happy to let you know more about that. So I know that's not a great answer, Anthony, but it's the answer we have here at the moment. And it's one thing I think all the agent community is waiting on CMS to talk about. Debbie, anything new or different to add on that one?
No, Randy, you got everything covered at this point. Once again, you guys have any questions or concerns? If our team doesn't know it, we're going to go to Randy. Randy's does a lot of research on this. He's very adverse to everything that's going on. He knows what's happening. So if our team is not quite sure, we're going to definitely check with him. We do a lot of research. We talk with each other. So feel free to contact us if you have any questions, concerns, or anything to help you out.
All right. Thank you, Debbie. So let's talk about where we've been today. We talked about new marketing rules around your materials. We talked about new rules around your events. We've talked about what changes before an appointment with your scopes of appointment. And we talked about what happens during an appointment with call recording and more and more. So I want to hear from you real quick before we wrap up today. After spending an hour or so with me, 50 minutes or so with me, what do you feel more confident in as you approach AEP? And what do you need more information about? Website disclaimer notwithstanding, because I don't know that anyone has any more information about that. Let me know where you need, what you feel good about, or where you still think you need some more help or some more clarification. And while you're thinking on that, I again want to thank all of you for your time and attention here today. Always a pleasure spending time with our agents and talking a bit about what's going on in the market. We have a series of 9 webinars this month geared to help you get ready for AEP and OEP. Invite you to check out our training calendar and see what else is up on tap here. Always open to everyone. So come on in, see what we're talking about here, see what's new in the market. If we have the pleasure of working with you already, you already know where to find us, whether that's at your account manager, whether that's me, Randy Lober, our Lober at actionbenefits.com. I'll put my email in here as well. But if we don't yet have the pleasure of supporting your Medicare business, there's lots of ways you can get in touch with us here as well. Follow us on LinkedIn, see what we're talking about here as well. Feel free to reach out to either info@actionbenefits.com or 248-356-8585. And we're happy to have a conversation with you about what, how we can best serve your business and help you grow your business going forward. All that said, Anthony, thank you for your feedback. I'm glad you feel more confident here. I, too, am worried about CMS not providing a lot of clarity around disclosures here. We can, we're doing the best we can with what CMS has and hasn't said there. As soon as we know more, we'll probably put out an email alert to our partners, as well as put some information on our website blog to help everyone comply with this here as well. Martez, I see your question here. You asked about a toolkit sign from Blue Cross that says Medicare specialist on site. Have to take that down in a location now. Martez, it's going to depend on when you had that sign put together, I think. Well, let me rephrase that. Because it says Medicare specialist, it's no longer good. But however, if you did get that sign perhaps earlier in the year, before the new rules came into effect, that's probably where CMS, where Blue Cross said, yeah, sure, that's legit, we can put it on there. But now that it says Medicare specialist, it likely does not pass compliance rules. I would encourage you, though, to reach out to your whoever you work with at Blue Cross on that to see if they can maybe issue you an amended certificate. And again, if you need help or an amended banner, And again, if you need help getting in touch with Blue Cross, feel free to call into our office. That's what we're here for, to kind of be your middleman between yourself and the carriers here as well. All that said, ladies and gents, happy to see any question or answer any other questions you might have. I'm going to stop the recording here, so there's not a bunch of dead air at the end of it. But Debbie and I are happy to stick around for any of the questions you have. If you must go, though, because we are approaching the top of the hour, we again thank you for your time and attention. I always love spending time with our agents. Look forward to seeing you again at another Action Academy session.